Okay. Again, I want to thank Michael for his service. Michael Stoltz. Again, he has been a leader at the Mental Health and Wellness since 1990. He was the first executive director of the organization. The predecessor was the Clubhouse of Suffolk since July 2014, and the CEO of the Association for Mental Health and Wellness. So again, Michael, thank you for joining me here today. I have a proclamation I will be presenting to you for your many years of service. Michael received his MSW in 1982 from Adelphi University. He was a professor at Adelphi. You were a program supervisor developing and implementing Suffolk County intensive case management programs. He is a member and the immediate past chair of the Board of Health and Welfare Council of Long Island, as well as a board member of the Long Island Home, that's the parent organization for South Oaks Hospital and Broadlawn Manor. You do have a lot of accomplishments, of course, and I just want to make sure we can present them, of course, to our public that's watching this. Michael was appointed to Suffolk County's Welfare to Work Commission. He was named to the board of the Mental Health Association of New York State. And he's a member of Stony Brook Medicine's clinical network performing provider system that oversees Suffolk's delivery system reform incentive payment initiative. And again, I know you're retired and these are all the many things that you've done and we greatly appreciate it. Let's say as a past president of the Ronkonkoma Rotary, that's where he has been he had been an active member from over the 20 years that you have been there. And again, recognized as a Paul Harris Fellow, another award that you received. You were also the past president of New York Association of Psychiatric Rehabilitation Services, and also honored with the Irvin Rootman Award for Executive Director of the Year for the International Association of Psychosocial Rehabilitation Services. And the list goes on. Michael, he's right now has since retired again from Smithtown with his wife Robin, and also you have two children, I believe. Let's see. Or no, Michael and Robin, right? Support Leah, and that's your daughter, right? Girls, yes, Leah, right? And with her initiatives again, I believe she's working with the Curvy Girls Support Group. Is that she founded when she was 13 years old. What a beautiful accomplishment for your daughter. As far as where you have been when I started working with you, that was with the Mental Health and Wellness Association. And again, it is the result of a merger with the Clubhouse of Suffolk County's United Veterans and the Mental Health Association in Suffolk County. And again, thanks to Michael, the agency has an $11 million annual operating budget, 150 employees, and serves more than 3,500 people each year at the facilities in Ronkonkoma, Riverhead, and Yaphank. Again, the association coordinates dozens of anti-stigma events and workshops on Long Island, and that mark National Mental Health, National Mental Health Awareness Week. There you go. Again, and we know it as Miha. Is that or Ma? Is that how you pronounce it? As a short MHAW. But again, and it has made such an incredible impact for those, again, with mental health issues, disabilities, and trauma. And again, achieving goals of education, employment, social connection, housing, community involvement, and overall wellness. I wanted just to, again, congratulate you for the many years and the many people that you have served as a leader and understanding what we can do to help those that are going through these incredible challenges. And now that we're dealing with COVID, it's another level of challenge. We thank you for all your work, and we hope that your institutional knowledge will continue to be with us here in Suffolk County, because again, we need you as much as the folks here have needed your leadership. And we again thank you so much. And again, working with the Welfare to Work Commission, and also we're working a lot with the Quorum Plaza Resource Center initiative. We greatly thank you for all the work that you've done. And with that, I'm going to go right here. I have now, thanks to the magic of Zoom, but I don't know really how to make this happen, but this is the proclamation. I don't know if you can see it, but I will present this. I'm trying to get just right. And this is, I greatly thank you. Let me just see if I can get it right. Because we have the proclamation, but it doesn't show. I thank you for all the work that you've done. And here, I will hand it over to you. There you go. Okay, you're supposed to take it there. Okay,
oh, geez, it's heavier than I thought.
But we will mail this over to you. And I can see, being retired, you're in a beautiful climate right now, and the warmth cannot outshine the warmth that you have in your heart for the so many people that you have
that was
helped.
beautiful.
So thank you. Well, again, it comes from the heart. It really does. And we have to do more for those that are in need, especially dealing with mental health. It's one of my top priorities. And you are such an incredible leader, and understanding what needs to be done. So would you like to say a few words?
I would. Well, thank you, Legislator Anker. It's been an honor working with you, getting to know you from the Welfare to Work Commission, and then expanding our kind of relationship with respect to mental health needs and social service needs of people who have at disadvantages in our county. So I do want to say a couple of things. So one is I have been ably succeeded by Colleen Merlot, who will be, I'm sure, at your service and at the service of the legislature and the executive branch as needed. Colleen is extremely experienced and capable, having headed the Mental Health Association in Suffolk previously, and Long Island Against Domestic Violence. So I know that I speak for her when she says she's looking forward to working with you. Certainly, I've had dozens of opportunities to speak in front of the legislature over the years on a variety of topics. Mostly about understanding the role of mental health. Obviously, since COVID, now everyone understands the role that mental health plays with respect to our satisfaction in life, our productivity as workers and employees and employers, in our educational system, in our healthcare, with respect to decisions that people are making around COVID, around vaccinations, around treatment. All those kinds of things. Now we understand that mental health is a more critical element than ever before in social policy, social health policy, and social welfare policy. So I hope that, one of the outcomes of this crisis is that higher level of understanding and appreciation for mental health. A lot of us have been working on these issues for a whole lot of years, for kids, adults, or seniors. I know that I'm not done with my work. My role is changing. I will only be here in the warm weather for a short time more, and then come back and join you in the cold.
Sorry.
But it's
remember,
all
the
good.
warm heart will keep you warm. The warm heart will keep you warm.
Thank you, Legislator Anker, for taking the time and for saying such kind words. Thanks to you, and thank you for your aid, Emily, as well.
You're so welcome. Yeah, and if this goes, I think we're going to post this, but Mark Grossman also is with the former organization, right? And then also to get the word out with mental health, a very strong advocate. And then have my picture here. Emily, actually, Murphy is my staff member who is taping this and going to get this ready. So see if we can put this out to the folks that, really need to be inspired. Like people like yourself. We have, I just heard recently the high rate of suicide in children because they can't go to school, their routine is disrupted, teens, but even young kids. And, we need to do more to help, our senior citizens are fearful, and they're literally staying in their homes, afraid to go out, afraid to even go grocery shopping. So it's really created more uncertainty. And I think that seems to prompt stress. When we don't know where to go or what to do about a particular thing. And in government, we're creating new paths. We're trying to deal with what is happening as it's happening. So it just, again, creates a number of challenges for everyone.
That's well said, legislator. And certainly, I've gotten lots of calls over the past year, and increasingly from families who are feeling the stress of isolating, quarantining, the losses that they felt, the health threats that they felt, and this affects every element of our lives, like we haven't really experienced before. I appreciate your commitment to learning more about kind of the role of mental health and spectrum toward serious mental illness and psychiatric disability as it plays in all elements of government policy and practice. So
right. Oh, you are so welcome. And again, we have a lot more to accomplish, a lot more to address. Again, the opioid addiction epidemic and colliding with the COVID-19 pandemic. It just, there's a lot. But I think what folks need to know is we have each other. And is there something that folks can bring back? Oh, I hear the.
I apologize. I'm right near a fire station, apparently.
No problem. We'll wind this up. Any additional words as far as encouraging those that are looking to seek mental health support?
Well, I think the state and my former agency and others are you have to look at COVID as having been a trauma, and I think a major change in mental health care over the past 10 years, even more so 5 years, is understanding the role that trauma has played in people's lives, from family trauma to associated critical events of childhood and such. And this is a trauma, and that means we all have different reactions to it. As I said, I'm getting calls from couples, families, and such about the role this distress has played, and that is often the second response to a tragedy or a disaster, is to start to really see the mental health kind of implications of those. So I hope that the legislature and the executive branch will keep that in mind. The impact of this trauma on people's lives and what that's going to mean for many, many years to come in our social services.
Very good. Yeah.
Thank you.
Thank you. And again, I've seen, especially with the opioid epidemic, that I chair the panel and I work with a lot of the folks that are involved in this. And I see the advocacy. I see the transition of understanding that addiction and mental health go hand in hand. They're co-occurring diseases. But I also had worked a lot with the cancer advocates and the breast cancer advocates, and it took that group of people and that type of advocacy to help people overcome their fear of discussing the disease, a cancer, because decades ago people didn't talk about it. Now people talk about it because we're all looking for, help, for resources. And there's a lot out there, and especially, what you've been able to do. So,
well, whatever role I can play going forward, a Suffolk County citizen and and resident for many years to come, and any role I can play and help any initiatives that you or your colleagues put forward.
Thank you. Now remember, we're recording this, so I have you on.
All good.
So I'll be calling you. No, I'll be reeling you in, and that's what, again, it's an absolute pleasure to to know you and to know that you are there as a resource for me, and then the many the 1.5 million people in Suffolk County appreciate everything that you've done. So. Thank you. So with that, again, I just want to thank Michael Stoltz. He has retired from the Mental Health and Wellness Association, and we will miss you from that your position within that organization. But we know you will be out in our communities looking to help those that are in need. And again, thank you so much.
Thank you, Liz.
Okay. All righty. I guess.